This is Helen Thompson. Thank you for being here today. If you've already subscribed to the show, thank you so much, mums. You always are amazing. And if you're here for the first time, make sure you subscribe to the show. You will find First Time Mums Chat on all the main platforms, including Apple Podcasts, Spotify, Amazon, as well as now on YouTube. Today, I'm bringing you the first of 2 episodes with an amazing woman. Austin has been supporting families for more than 20 years and has a wide repertoire as a craniosacral therapy practitioner, an international board-certified lactation consultant, a licensed massage therapist, baby-wearing educator, as well as a tummy time method professional. Combining her expertise in lactation, baby-wearing and craniosacral therapy, Austin is able to offer comprehensive care and support to families. During this episode, you'll hear Austin share tips from her vast experience, specifically around how she helps families faced with infant tummy troubles and tummy time challenges. If you're a new mum, or if you're about to commence your parenting journey, then you'll know that many women in our modern fast-paced world feel alone and unsupported. Many are isolated and lack support from members of their family, such as their mothers or other close feminine role models. I'm your host, Helen Thompson, and I'm a childcare educator and baby massage instructor with many years' experience working with families. I started the First Time Mums Chat podcast in 2021 to help support mums as they face the challenges and struggles that parenting often involves, particularly when getting started for the first time. To help ease your transition into parenthood, I aim to offer supportive, holistic approaches and insights for mums of babies aged mainly from 4 weeks to 10 months old. In each episode, you'll hear insights from experts and other mums to help you become the most confident parent you can. Let's do this together. This podcast is for informational purposes only and does not constitute medical advice. Please contact a medical practitioner if you are concerned or have any medical issues. Now, let's meet Austin and get on to the interview. Hi Austin, and welcome to First Time Mums Chat. I'm delighted to have you here today, and I'm looking forward to chatting with you about how you assist families. Can you please start by telling us about yourself and your background?
Thank you, Helen, for inviting me. I'm excited to talk about this topic because it's something that's common that comes up with a lot of parents on having difficulty with tummy issues and colic or troubles in tummy time. My background is I am a mother of 4, and I am an international board certified lactation consultant, and I'm a licensed massage therapist, and I practice craniosacral therapy, specializing in infants. So I work with a lot of parents. So a lot of families come into my office sharing that they're having challenges with baby being uncomfortable, a lot of spit up, and having a lot of gas, uncomfortable, unable to put down, and just really babies who are just not comfortable in their bodies, and then not sleeping as much, and then parents too are not sleeping as much or may have other children that they're tending to as well, but these babies who are having tummy issues are just making it a challenge for the whole family. As a craniosacral therapist, I see this sign of these spit up or tummy gas or a distended abdomen with that big poofy belly are signs to me that there are restrictions in the body. So as a craniosacral therapist, my fingers are trained to feel where there is tightness or tension in the body, in the tissues. And I use really light touch and use gentle movement, like micro movements to kind of push and pull through the tissues to get relief. The most pressure I use when I work with infants is about 5 grams, which is the equivalent of balancing a nickel on your finger.
Wow, I know with baby massage, I work on the tummy and I go in a clockwise direction and helps to release all the bubbles and all the tension in the tummy. Do you
as a craniosacral therapist, work in different areas to relieve colic, or is it just tummy? You mentioned reflux as well, because I know that's a big problem for mums.
Yeah, so when I work with a baby, I kind of see what areas are kind of calling for attention, and I love to place a hand gently on the belly and just see, if that gas is starting to come through, just kind of feeling on that exit chute, which is on the left side of the baby, and it's the right side for me when I'm facing the baby. And just kind of feeling if there's any motility or movement or gas bubbles. Some of the techniques I use will start to get those gas bubbles and movement through. I also go up to the sphincters, those little valves that keep the milk in the stomach, or if they open, it'll bring a little bit of that acid or milk up, and just kind of see if there's any tightness or any pull that's making that uncomfortable for babies. And I get that nice and relieved and open so that there's nothing pulling on that area. And so that it can also become a little stronger and stay closed and not open. But kind of checking through the whole body, even up to the throat, just to see if there's any restrictions there, and then asking parents too if baby has eaten in the last half hour. If not, I will utilize some massage techniques as well.
Hey mums, if you're looking for a simple way to help your little one sleep better, help strengthen and turn their muscles, soothe teething pain, and encourage their circulation in the legs and feet, and more, then check out the My Baby Massage Quick Start Guide. It contains quick and easy 5-minute baby massage techniques that I've handpicked that you can easily include in your daily routine. To get started now, go to mybabymassage.net/massage. That's mybabymassage.net/massage.
Yeah, I know from a baby massage point of view, massaging tummy just after feeding is not a good idea because it brings up all the gas and it's uncomfortable for them anyway. But if you do it after a feed, it's even more uncomfortable because the little tummies are still trying to digest all that milk.
Yeah. And I do recommend all of my families to do infant massage because learning those gas colic routines and not just one tummy massage to help them be able to utilize this during their days and when they are home.
Babies, when they have colic, it mainly comes out at night when the mothers and the babies and the family want to sleep. So is that with what you call the sort of witching hour? If somebody comes to see you, when's a good time for them to come and see you to get relief?
Well, that is a great question. It's usually when there's an opening on the schedule. But I recently read a report sharing that colic or reflux or tummy challenges are typically between 12 a.m. and 6 a.m. or 6 p.m. and 12 p.m. So ideally, I find when babies come into my office in the morning, it's a little easier. The way that my schedule works out, I work later on Wednesdays. So if I get babies, it would be in the afternoon. But I haven't seen a challenge in that. And it's not really in that typical witching hour that I work with families. But I do ask them, what do they do to find relief during those witching hours? And then I can give some more recommendations or answer any questions that they have, but also see what they have found that helps them during that time.
And what do you think about tummy time in helping colic? If your baby's lying on her tummy or on a ball or anything like that, do you, as a CST and a massage therapist, would you say that helps with colic? Is there anything you can do for tummy time that helps a baby to relieve colic?
So, yes. And a lot of parents whose babies are having challenges with spitting up after feeding or tummy hurts after they eat, they tend not to put their babies on their belly or even trying to find a good time during the day to do tummy time when they're not feeding or sleeping or uncomfortable. What I
Mm-hmm.
recommend is babies tend to be somewhat alert and comfortable after a feeding. And parents instinctually, with babies who have reflux or colic or irritated tummies, we'll keep them upright on their body for about 20, 30 minutes after feeding. And I share that research has shown that babies who have been diagnosed with reflux, that being upright, like they instinctually are holding them, or on their belly or on their left side are the most comfortable positions for them after feeding. So if they're in a good mood, then let's do tummy time right after a feeding so that you can engage and baby's in a good mood. Some parents will share that there may be a little bit of spit up right afterwards. We just put a blanket on the floor, just clean them up and just move over a little bit when they're on their belly. And that pressure, that gravity up against their belly helps with moving gas. And it also helps with strengthening the valve that goes over the stomach to keep that milk in the belly.
Some parents say to me that the baby doesn't like tummy time and they don't like doing tummy time, but I always say to them as a baby massage instructor, just do it slowly. Take it one step at a time. Maybe just do 2 minutes and then lift them up and play with them, give them a cuddle and do what you need to do. Then lie them down again, but just do it gradually and not push it too much. Even lying them on you is still a form of tummy time because you're getting that skin to skin as well. That's comforting for a baby if they've got colic or they've got congestion or digestive issues. It can actually comfort them because they can also hear your heartbeat, and that's what they felt in the womb as well.
I do give some tips and tricks on how to do it on the floor, but the first 2 weeks of life, that gold standard tummy time is on the body. You brought up skin to skin, and that is something that parents can do to alleviate pain, to increase digestion, to increase immunity, independence, intelligence, and it reduces pain by just bringing them skin to skin, which is nothing on from belly button up on the caregiver and the baby, up against the body with their head to the side, arms flexed, and the knees bent, kind of like in the little frog position up against the body. Research has shown that babies who have had reflux or diagnosed with colic, that by just simply doing skin to skin, decreased crying from 3.5 hours a day to 1.7. So having a little research
Wow.
to put behind something that we've been doing for comfort.
Wow, that's a big difference. I know how important skin to skin is, but I didn't realize that. That's amazing. You can still give your baby skin to skin time if they're lying on their tummy on the floor, because you can play with them and you can talk to them and you can have eye contact with them and hold the little hands and help them to move to the side.
So even if baby having naked tummy time is extra credit to a lot of parents will do it like after bath time, on the floor with a parent. As soon as it's a little too much for them, I encourage parents just to roll them back onto their back and pick them up and calm. And it's just dosing little bits throughout the day. As far as skin to skin is any skin contact from caregiver to baby on any surface of the body. However, it's that kangaroo care, that sternum to sternum, that chest to chest, bare chest to bare chest is where we're going to get those big changes that reducing crying, pain relief. It also reduces the stress hormone in both the caregiver and the baby by just bringing them next to each other on their chest for that skin to skin kangaroo care too.
It also releases oxytocin as well, which is the love hormone, which I actually love to call the cuddle hormone, because to me that's exactly what it is. You're giving that cuddle and you're giving them that support, and it's releasing all that love while you're doing that, and it can also release pain at the same time.
It can, yes.
So you've mentioned a lot of tips. Is there any other tip that you would recommend to a mum who is struggling with tummy time?
Yeah, so for babies who are not interested, so finding those key times. So I would say let's do it after a feeding and see, because a lot of parents don't do it after a feeding, and see if that's a key time. Keeping them upright on their body, babies who have difficulty on their belly give me a sign that there's something else that's making it hard. So I also act as a detective, as a craniosacral therapist, to find what could be causing this, making sure a lot of things on feeding going well. If they're having some challenges with that, maybe some air is getting in from either the breast or the bottle, which is making the tummy have a little bit more gas. Little bit on the floor, having something that's, we call it a novelty, something that is extraordinary that the baby wants to see. And that's usually parents' face or hearing their face, getting on the floor with them. It could be a rattle, it could be a sibling. It's great when there are older siblings running around because they want to see what they're doing. I'll usually ask them to ask their 2-year-old to show them their favorite toy so that baby can get interested in their environment on their belly. When it's too much, roll out and pick them back up. You can always do little bits. A tip is to do it at a diaper change. So when parent is trying to find times to add in some tummy time, you already have diaper changes set into your schedule. So clean out the baby, roll them to their belly, hang out, have their favorite toy by their changing area, and then roll them back and put a clean diaper on. So that's a good way to do it as well. Yeah.
Yeah, I love mirror play. I think when babies are on their tummy and they're having mirror play and you're lying with them, not only are they seeing you and seeing your face, but they're learning about expression and they're learning about different ways to look at you. And if you're fiddling with your fingers, they're learning about the fingers. You can encourage them to have tummy time by giving them that mirror play because they're excited about seeing their face and seeing your face or seeing a sibling's face. Mirror play has so many benefits.
They really do. And there's an age where like faces are just very intriguing, and that's something that can really keep them engaged when they're on their belly. Also, just rolling them to their side for a little bit before rolling them onto their belly can help as well, especially having some pressure on all 4 planes, their belly, their left side, their back, their right side is really good for them to have that time on their side as well. Knowing babies who have colic or reflux or tummy challenges, rolling over to that left side before rolling onto their belly might be comfortable too.
One question on that, why on your left side? Is that because that's the way the bowel moves?
The research that I have read showed it was mainly for infants who were premature and in the NICU. They found that laying on the right side had faster gastric motility. So the stomach emptied faster on the right side, which was good for weight gain for little babies, but it may be uncomfortable for those who are having some tummy challenges. But that the left side, since the stomach's over here, was a little bit more comfy. And it probably has something to do with that's a little exit area of the GI tract too. It starts over there on that left side.
It's interesting. Well, thank you. I've learned a lot more about tummy time from you and the left and right sides and when to do it. So thank you for all your tips and advice.
Some things that I've asked parents that help them during those witching hours, a lot of them will share using a baby carrier. So using a baby carrier during those times have been very advantageous. I share that those carriers that are a little bit more fabric and can be tied on or a little bit more comfy are great to use skin to skin with the baby carrier during those challenging times. So it's just an extra tool for families who are doing tummy time, but doing skin to skin or kangaroo care is adding a baby carrier so you have 2 free hands as well during those tough times.
Yeah, that's another topic. I love baby wearing. It's got many benefits as well for that challenging time when they're having that colic or digestive problems. Thank you. That's a great tip for mum. So if anybody wanted to get in touch with you and find out more about what you do,
I have a website that has a lot of information on what is craniosacral therapy, what it helps, results that parents can see, and a lot of frequently asked questions and pictures. And it's my business name. So it's Nourish andalign.com. And I'm happy to answer any questions. There is a way to get in touch with me through the website, or people are welcome to email me as well at austin@nourishandalign.com. I am located in Baltimore, Maryland, in the state.
Well, thank you, Austin, for sharing your expertise. It's been a pleasure talking to you. So thank you very much for being here.
Thank you. I've had a blast.
Thanks, Mums. You're amazing. And I hope you enjoyed this episode. I'll be chatting with Austin in August about concerns that many parents have about their baby's head shape. So if you haven't done so already, make sure you hit the subscribe button now. The other thing I want you to do after listening to this episode is to get your free simple baby massage technique quick start guide to help your little one sleep better and strengthen their tone muscles, encourage their circulation in their legs and feet, and so much more. To get yours, visit mybabymassage.net/massage. That's mybabymassage.net/massage.